Good afternoon once again. Today is Tuesday, May the 5th, 2020, and this is the English language summary of the press briefing of the Center for COVID Situation Administration, or CCSA. First of all, I'd like to start off by saying that today, of course, is the second or third day of the easing of restrictions. And in general, the compliance rate has been very high. As the spokesperson had mentioned, only 100% of compliance and cooperation will get us through all of this. So therefore, we have to thank everyone for their continued cooperation. There's still, however, room for improvement to prevent the return of the infection, and we still request all to be vigilant and act in accordance with the guidelines issued. Also, in terms of the protection measures, a survey had been conducted. So we'd like to thank the general public because around 91% have proven to be wearing masks and washing hands at a high percentage as a habit now. And the need to do more of social distancing is still in place, around 1 to 2 meters apart. That still has to be improved because the numbers we have is that only around 65% of that is implemented on a regular basis for the general public. And of course, not touching your face often as well. One issue which we'd like to recap, update, is of course the issue yesterday that we mentioned about the cases in Yala province. At the moment, we are still in the process of reviewing the aspects, the laboratory verification aspects. That is still ongoing because there's a need to build the highest confidence and avoid any weak links. So that is still ongoing, and we'll have information for you in due course. Another issue is, of course, the sources of infection in southern Thailand, which includes the immigration detention centers in Songkhla province in particular. Of course, the cases found are a result of the proactive contact tracing and active case finding to ensure that there is no group left out or goes undetected. So moving on to the general situation and the number of cases that we have for today. We have one new confirmed case, as you can see on the slide on screen. And that case is from Narathiwat province, making the cumulative number of cases in Thailand now 2,988, wherein of that number, 91% or 2,747 persons have recovered or been discharged, and no fatalities. As for certain observations, of course, we want to avoid congested public transportation. Today we've seen some images of congested public transportation, particularly in Bangkok. But at least, as a spokesperson mentioned, most of the people were wearing masks. However, we still encourage all of you to avoid unnecessary travel, of course, especially during rush hour. If you can work in different time durations or work at home in your offices, that would still, of course, be very ideal. Or the public transportation operators would be considering about increasing the capacity of trains and buses and the like to avoid congestion. On the issue of the enforcement of curfew, we have some numbers for you today. Violations leaving residence is 580. In terms of gatherings, it's around 678 persons. So we have some images for you on screen of the enforcement that we are performing, with more than 2,000 multidisciplinary teams sent out to monitor the compliance of the various measures at businesses and places of activities, totaling around 9,300 venues. And more than 95% were in general in compliance with the various measures. And all businesses have expressed their readiness to cooperate as they see it as a common benefit and common responsibility in society. The spokesperson also showed some graphics about the compliance of various business sectors as well. So, like for example, restaurants in one cluster and department stores in another cluster, or golf courses and public parks. So, in around the numbers that we have, so in restaurants, around 3,100 venues were monitored, were visited, and there were around 6% who did not comply. So that's actually the highest number of percentage of non-compliance in terms of the restaurant group. So hope that would be improved in due course. In terms of the curfew itself, there is a slight reduction in the number of violations from yesterday, but alcohol and gambling and drug-related activities still make up the majority of violations. So to keep the public and yourselves safe, please refrain from undertaking any activities that are in breach of the measures announced. If you come across any, please, that are potential violations, please report that to the authorities. So moving on to the issue of Thai nationals abroad in terms of repatriation, we have information regarding that by land and air. For flights coming in today, Tuesday, May the 5th, 2 repatriation flights, as you can see on this slide, from France and from Chennai, India. And for tomorrow, 3 repatriation flights from Myanmar, from Frankfurt, Germany, and lastly from Pakistan. So to date, the government has assisted a total number of 4,401 Thai nationals by air in their repatriation from 26 countries and territories around the world. And as you can see in the red box, the strict measures in terms of having the repatriated persons enter the state quarantine system, that of course is still in place. As for activities of the Thai embassies and consulates, we have some images for you as usual. First is the Royal Thai Consulate General in Hong Kong successfully facilitated the return of Thai nationals in Hong Kong and Macau. We also have images of the Royal Thai Embassy in Colombo, Sri Lanka, with the Honorary Consulate in Maldives facilitating repatriation flights from Malé with 131 Thai nationals able to return home. And apart from facilitating the repatriation of Thai nationals abroad, the Ministry of Foreign Affairs to the embassies have provided necessary supplies to the Thai community in various countries. So it is our commitment to have everyone be properly taken care of and assisted and accounted for. We also coordinate with other Thai agencies in support of the livelihood of Thai nationals around the world. So currently, the Foreign Ministry has been in collaboration with the Ministry of Social Development and Human Security, particularly the Department of Women's Affairs and Family Development, in the process of distributing cloth masks specifically for Thai women groups around the world, abroad. So that is we have some images for you, yes? Yes. So moving on, we have some inquiries which were sent to us on social media and as well as asked directly, addressed to the spokesperson. So first is about, the question is about, does every province publish their regulations in English? How will people get the right information about the necessary travel restrictions in between provinces? And the websites available for provincial regulations, providing contact details in English. So with regard to the necessary travel between provinces, CCSA recommends that you travel, of course, when necessary, and you have documents related to the travel to be presented to the officials at checkpoints around the country. The regulations for each province are available on the government website, which is thaigov.go.th, as well as the website of the Ministry of Interior, which is worldwideWeb.moicovid, that stands for Ministry of Interior, moicovid.com. which also includes contact information, numbers, and the availability of the English versions for each provincial regulations will vary from province to province. So please kindly check with the website or contact the provincial administration for further information. Another question is about the information provided here at the CCSA, the slides shown on screen during the press briefing of the spokesperson. Are they posted on the website or page? And the person asking was asking about the contact numbers in English a few days ago, which of course I answered in the previous question. But in general, of course, the useful information on measures are available in English mostly on the Facebook page of the Public Relations Department. That's PR Thai on the Facebook page, the Public Relations Department. Also on the website of the Ministry of Foreign Affairs, the Facebook page, if you search in the Facebook page for MFA Thai, as well as the website of the Department of Disease Control of the Ministry of Public Health. Also, the daily English language reports on the situation in Thailand are also available on the Department of Disease Control website in terms of the SA or situation analysis. They have a sheet issued every day on that website, which includes the total number of confirmed cases, the daily statistics, newly confirmed cases, and the like. Another inquiry was about Vesak Day, because tomorrow is Visakha Busha or Vesak Day. The government has issued the directive on all temples in Thailand as well as Thai temples abroad for the temples to refrain from religious activities tomorrow that would have the high, dense concentration of people. However, the activities and the internal prayer activities of monks would still be able to take place. And I'd like to correct myself, it's not a government directive, it's the Sangha Council of Thailand who issued this guideline. So, just in terms of the concluding notes, I'd like to start off first by saying that, as the spokesperson had mentioned before, about the various cases, there was a number around 18 reported yesterday of persons under the control of the immigration office, particularly in Songkhla, where they were found to be infected with COVID yesterday. Of course, this is a result of the proactive contact tracing, active test finding, to make sure that all the potential possibilities of infection is dealt with. So it's not beneficial only for Thailand's health security, but also, of course, for our neighboring countries. As, of course, disease, infections know no boundaries, nor does it differentiate between nationalities. Of course, we will not win this battle against COVID alone. It will be a long and concerted fight by Thailand in cooperation with our neighbors and countries around the world. So, in summary, Thailand's government will not leave our friends behind, and we will provide the necessary medical treatment for all individuals found to be infected in Thailand, as this is Thailand's humanitarian tradition as well as our strong health support system. And the spokesperson and myself mentioned a couple of times in the past as well about the issue of anti-stigmatization and non-discrimination, of course, of those infected with COVID. It's not that when we find people with COVID, people in the community would put a stigma on them and, of course, discriminate against them. That's not something that we hope would happen. We have to be one and help each other in solving this. It doesn't matter, of course, which profession you have. If you're a Thai person in the agricultural sector, if you're a business person, if you're a vendor, it doesn't matter which profession you have, nor where you are placed in Thailand's economy or Thailand's society. Everyone has the same risks and therefore should not be stigmatized. At the same time, Thailand remains committed to our international obligations, the international frameworks, the United Nations, the International Organization for Migration. And Thailand recognizes the contribution of all Thai persons and their value to the economy, At the same time, we recognize the value of migrants to our economy as well, and our policies will be migrant sensitive. Because, of course, disease knows no nationality. And we hope that we will have zero infection for all. That is indeed the right perspective that we should have. So therefore, we should leave no one behind. And can I have a slide on this, please? So therefore, we must maintain that we should leave no one behind. We should remain inclusive and compassionate as a society in times of crisis. And of course, if you live in Thailand, you would know, of course, the word "nam chai," which Thai people have to one another. It might be translated as compassion, but perhaps more directly, it can be translated as the outpouring of the heart. So we hope that this will be the theme, this will be the perspective and understanding as we face COVID together. Please stay strong. Please continue to follow the measures. We are one in this, and we will solve this situation in due course very, very soon, we hope. So thank you very much for your attention. สวัสดีครับ